Now, as the number of coronavirus cases increases in Israel, many of us are wondering whether or not the rise is a result of more testing or a result of people failing to adhere to social distancing. Well, joining us with some answers, hopefully, is Dr. Salmon, the head of the International Relations Department in the Ministry of Health. So let's begin with the number of COVID-19 infections in Israel. Why are these numbers continuing to grow?
Good afternoon. Well, it is working like we had predicted by the curves. It's not extremely high. We had even a world forecast, and it's quite in the boundaries of where we believe that we would be at this point of time.
Now, are we seeing a positive or negative trend with the infection rate? Because we're hearing new reports that there are going to be even stricter regulations starting tomorrow, if not a full lockdown.
Well, it's a bit too early to say because we would see last week action into the curve just, I believe, at the end of this week or the beginning of next week. But we have some clues that put us in a point that we do see the effect of the last closure regulation.
Why this lockdown then?
Well, it seems that we are still rising in number, and we have to tighten the regulations because still there are too many open gaps that people are getting infected through. So we would diminish the amount of people leaving home to work. We would shorten the time that people are exposed in shops and other shopping events. We'll try to reduce people which are wandering out of their homes with no good reason. It's not going to be a full lockdown. It is going to be just a bit tighter closure than we had till now.
All right. Now, right now, there's a big concern about the lack of respirators in Israel for coronavirus patients. How is Israel dealing with this?
Well, we are trying to purchase ventilators all over the world. It became quite a wild market. People are buying second-hand ventilators, trying to sell them in ridiculous prices. There is a shortage. We experienced events where we had already a closed deal with a tight contract, and the supply just disappeared. We had issues like that, but hopefully we are somehow successful in collecting a substantial number of new ventilators.
Now, are the majority of the new cases that we're seeing specifically coming out of ultra-Orthodox communities in Israel? And if so, what is the government doing to crack down on these communities?
I think it's mostly proper, I would say, explanation and promotion and education of the community. Enforcement is an important tool, but it's not the major tool. The major tool is to make the community understand the risk and cooperate by understanding and not by fear.
Mm-hmm. Now, so far, all the deaths that we've seen in Israel have been 67 years old and plus. Seniors are considered to be the most at risk of contracting the disease more severely. But are there young people right now who are in serious condition? And worldwide, are we seeing younger people also dying from this disease?
Yes, indeed. That is a misunderstanding, believing that it's only a problem of the elderly population. We did see cases around the world of people dying in their 30s and 40s. And there are even reports about children which died from the disease. So it is a mistake and a misunderstanding to put this as a problem of geriatric population. Now, in Israel, thank God, we did not have any mortality cases of young people, but we do have young patients in critical and serious conditions.
How long can the disease live on surfaces?
I don't know. There are contradictory studies. In the beginning, I did have the impression that it usually wipes out after a few hours, but there's now some studies showing that on certain types of surfaces it could survive for much longer, even days. So I would just ask people to be cautious, and I hope we'll have a more substantial data about the risk in the next few days.
All right. Well, Doctor, thank you so much for joining us.
You're welcome. Have a nice day.